person because I got my copy of The Web That Has No Weaver, which is an acupuncture book, and I got my physiology textbook out. I opened a multi-up kidney, and I started trying to make sense of it all. And I'm still trying to make sense of it all today. But I graduated from Pacific College in 2003 and got my license to practice acupuncture in the state, and started to come back and do some work for Pacific College. And where I started to work was at the UCSD student-run free clinic project, which is has 3 locations in San Diego. And it's a acupuncture clinic that also operates with a medical clinic and with a legal clinic and with social workers and a dental clinic. So it's really an ideal location to do integrative medicine. So I started my career, I guess, there, and I've been working there ever since. And I also work at Rady Children's Hospital with Leslie and with Casey Conover. And we've had that program going for about, I think, the last 4 years. It's been going for 4 years, almost 5 years. And so we do acupuncture in the Children's Hospital here in San Diego. Primarily we work in the chronic pain program, treating kids with chronic pain, and we work in the hematology oncology department. So really get a chance to see what integrative medicine is about there and to see how we can develop an integrative medicine program, because I started working there kind of in the program's infancy. So it was really an opportunity to see how, as licensed acupuncturists, we can go into a fairly conservative medical environment in the hospital setting and really make ourselves useful and do good work and treat patients and make a difference and really start to, and I've seen over the last 4 years how we've been able to change things at the hospital a little bit where we're at. So it's really been nice to see people who work at the hospital get to know us and start to open up to us and trust us and see really some of the great work that we do. It's also been great from my standpoint, and I think from the rest of us working at the hospital, to learn more about how the medical establishment works. So really that's UCSD and Children's Hospital are primarily where I operate in an integrative fashion. And that's really what I think is the future of medicine in general, is all of us working together and integrating, coordinating, and communicating with the best interest of our patients at mind. So it's been a great start, and I hope to continue doing this work, and I'm really looking forward to speaking with all of you and answering some questions as we go forward. So I'll cut it short and let Leslie talk. Nice to meet you all.
I'm Leslie McCoy. I've been in practice for over 10 years now, and I was lucky enough, I'm a PCOM graduate, I was lucky enough to walk into a situation starting in an integrative facility the month after I got my license. And I worked very closely with a medical doctor, and we would do physical exams together, and so I would get to see firsthand, kind of learn from him the way that he approaches patient care. And he was, he's a very open-minded practitioner, and that he would use anything that he thought might benefit his patient. So he was very frank in his discussions with me about what kind of things he thought his medication could treat well, and the kinds of things that he didn't feel like he had answers for. And so we would work together and say, well, I don't know who's got a better approach to this patient. Let's try a couple of things and see what happens and see who gets better. And in that way, we were both able to learn firsthand the kinds of conditions that respond quickly to acupuncture, or things that maybe you need to combine different treatments to get the outcome you were looking for. And we did find in many cases, particularly when we were working with orthopedic or pain cases, that we would both walk in, examine the patient together, and come up with a treatment plan. And so he would often do, his pain injections or cortisone injections or whatever he had chosen to do, and then he would say, now we need to follow this up with acupuncture. So we would do acupuncture right there at that time, and then have the person come back for follow-up acupuncture. And very often, the person was experiencing more pain relief than when they just got the one modality alone. And so I've since left his practice But he has brought in several acupuncturists since he was so happy with the experience of having acupuncturists right in his office. So that was really my introduction to integrative medicine. And since that time, I have been fortunate enough to work with nutritionists and chiropractors, and right now I'm working with a midwife, which is a lot of fun. And again, I'm with Erin up at Children's Hospital, and that's always a learning situation for us.
Oh, okay. I'm Marcy Bothwell. I'm an ENT surgeon over at Children's Hospital. And my first experience, I grew up with my mom not letting us have any antibiotics and things like that because she didn't think it was good for us. It wasn't the natural way to heal things. And so that's always been kind of my milieu. But I kind of forgot about that and then went on to med school and, learned the allopathic traditional way, and, everything needs an antibiotic or, an antiviral of some sort or other. But then I got interested. I went over to China in 2001, and they took us out to Guilin and showed us a traditional Chinese medicine hospital. And so it was very interesting. There was an incredible language barrier, but one of the funny things was I was asking him, so how do you treat ear infections? And the guy goes, and he looked at me through the translator and he was like, well, you treat the liver. And I was like, what? Tell me again, is the translation wrong, and so I said, the culture, and so it was a very unique experience where you just had two cultures colliding. I was like, what? And he looked at me like, you do what? You stick a needle where? And so I walked away, and I was thinking about it, and I did a lot of reading about it. And, frankly, there's a reason why China is the most populous nation on the earth is because, they live longer and are healthier, a healthier population. So I figured, there's got to be something more to this. So I've continued to do a lot of reading on it. And then when you do that, you realize that they can integrate so beautifully. And especially as the Western medicine is coming down around to antibiotics aren't the greatest things, and how they actually destroy a healthy immune system and destroy a healthy gut. Now, where I have problems is trying to convince our U.S. population who wants the magic bullet to fix everything, convincing them that diet and lack of antibiotics and things are probably sometimes even better treatment than me just throwing a thing and getting them out the door is always a challenge. And so, any help on that endeavor. I also run the pediatric airway and air digestive team, and so we again are really focused on bringing the different specialties together, our speech pathologists, our occupational therapists, and everybody working together to try and come up with the best formula for the plan. So coming here and doing the integrative medicine thing, it just fits right into my milieu, and so that's really the most I have to say. I'm happy to answer any questions.
Cool. Hi, I'm Dr. Joe Merlot with Good Vibrations Family Chiropractic. I apologize for being a little late. My wife, Dr. Stacy, was supposed to be here as well. Our daughter, she needed to go to bed, to say the least. We had to make that an executive family decision. What I can share a little bit about my history. I was born to a mom that had me at 15 years old. In New York City, and she would come home sore and pain, sick a lot, and I would have her lay down, and I would work on her. I had no idea what I was doing. Over the years, my skills developed. She would feel better. As I got older, I started taking some anatomy classes. I fell in love, and then I realized, wow, what could the human body do, and how can I access it? Because there's so many beautiful ways to do it. I do it through chiropractic. There's acupuncture, there's massage, there's Reiki, there's toning, there's yoga. There's so many beautiful ways, and it's a matter of figuring out how we can integrate all those so that way we can help, in our office, how we can help families really optimize their health, their vitality, and how they experience their life. So that's a little bit about me, and I'm really happy and excited here to answer any questions and be with an amazing group. like you guys.